When most people think of stroke, they usually picture a very old man who is collapsing suddenly. But that's not always true. Women suffer stroke too, and often in silence. And what makes it more dangerous is that the symptoms are not always the classical symptoms of stroke. So I have treated patients who came to me only with excessive fatigue, with headache, with persistent vomiting and confusional episodes. And that is why even the family members, they could not recognize it until very late. Women's brains are not weaker, but the risk pattern in them is slightly different, especially during the pregnancy and during the postpartum, all the hormonal shifts that happen in them. So that is what will impact the blood clotting. But in addition, if you notice any of the atypical symptoms like sudden severe headache or persistent hiccups, recurrent vomitings or momentary confusion or even the loss of focus, these do not fit into the classical fast signs, but still they signal the same emergency. So if you notice these symptoms for however brief period, never ignore them, because it is always better to rule it out rather than regretting it later. So try to reach a stroke ready hospital at the earliest. In a country like India, especially, women always tend to keep themselves in the last. So they keep running for their kids, for their family members, to their work, home, and they never really prioritize themselves. So I have heard lines saying, I did not want to worry my family, I did not want to bother them, I thought I was just too tired. So this habit of self-sacrifice is the reason for the delay. And in stroke, delay costs not only neurons, sometimes the life itself. So if you know any woman in your family who's a known diabetic patient, who is hypertensive, who has recently delivered the baby, so you can all help them by creating a simple health checklist. You can provide them the emergency contact numbers. You can explain them about the warning symptoms of stroke. You can see that they are compliant to their medicines. So by doing all this, you are helping them, and awareness is not just generated, it is a shared responsibility. The brain doesn't care about the gender. So women don't have to be stronger all the time. They need to be just heard. So if you learn anything today, you can pass it on to women you care about, because stroke stops here when we all stop assuming that, oh, it can't happen to her.